Good afternoon, everybody, and welcome to the webinar. Today, we are in our third session of our mental health series for Mental Health Awareness Month, which is May. And today, we're going to be talking about lifestyle changes after a heart event that affect your mental health. It's a really important topic and one that we talk about all of the time, but we wanted to take a really deeper dive into it. Before we begin, just a couple of quick notes. All attendees are in listen-only mode. If you can't hear, hopefully you can read my slide and check the audio button on your personal computer to assure that the sound on your own computer is on. During the presentation, type your questions into the Q&A box at any time. We will get to those questions at the end, but you can put them in the box anytime. A PDF version of the slides, as well as a recording of this presentation, will be available on the Mended Hearts website following the event. And then there will also be a handout in the handout section of the website. And also Leslie is going to put that into the chat box today for us. In case you don't know Mended Hearts, we here at Mended Hearts' mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. My name is Andrea Baer. I am the Executive Director here at Mended Hearts. And joining me today is a very special guest. Dr. Rollwitz is an organizational psychologist in private practice, but he's also a very active member in Mended Hearts and has dedicated the remainder of his life to helping other patients. And so we're so thankful for you to be here with us today. I am going to mute myself and turn it right over to you.
Well, thank you so much. This is the first time I've ever done a webinar. So you all just bear with me. I'm not that 100% tech savvy, but I think I understand how this is going to work. I just want this today just to be a conversation between you and me. And what I'm going to do is share with you my journey and what I've been through and what I've been going through and what I've learned as a heart patient, and also what I've learned as a psychologist that's applied to that, which has been probably the most interesting time I've ever had in my life in this last year. Let me just start by saying one thing. I am absolutely grateful that I'm here. I'm grateful that I'm here with you guys. I'm grateful that I can share what I've been through with you. And I hope that today you'll hear something that gives you hope, that gives you encouragement, that gives you comfort, because I can't think of a scarier thing to happen than to go through this. So let's just start by explaining to you how I came here. I'm turning 70 years old this year. And so I lived for 68 years thinking that I was in pretty good shape. My father had died from a heart attack. My brother had had a quadruple bypass, but I assumed that I was fine. I didn't have any heart issues. I didn't have any heart pain. I didn't feel bad. My blood pressure, even though I tried to ignore it, was a little bit elevated, but not too bad. I'd gotten a little fluffy over the years, getting a little bit overweight, but by and large, other than my knee, which I'd had a total knee done 2 years ago, I had not had any surgeries and I was on no medication. Literally, I had no idea that anything was going on. Well, I needed to have some follow-on work done to my knee. So I went and saw a surgeon, an orthopedic surgeon, and he said, look, I'm not going to touch you at your age unless I get a letter from a cardiologist that says you're good to go and that you could be fine through the surgery. And I thought that was kind of a pain to have to go do, but I said, you know, he's a great guy, and if I don't do this, then I'm not going to be able to have the surgery. So I went to a heart guy and I said, look, I just need a letter. And he said, well, I'm not going to just give you a letter. He said, I want you to take some tests. And then if you pass those, okay, then we'll talk about the letter. So he had me take 2 or 3 of the tests that I'm sure most all of you have been through at one point, a stress test and a nuclear test and a good Lord, and an echo. And he goes back and he says, well, you failed them all, miserably failed them all. He said, I need to get you in right away. I want to do a catheter and a TEE. And if any of you ever had a TEE, that's when they do that echo from the inside instead of the outside. And that is not a fun process. I did all of those and he came back and he said, you have severe aortic stenosis and we need to get you down to the surgeons. Headed down to the surgeons the following week. They did a heart CT scan and they said, well, we understand now what's going on with you. You have a 4.9 aneurysm in your ascending aorta, and you have very severe aortic stenosis, and that aneurysm could burst at any moment. And you're very, very, very lucky that you're even here. We want you in for emergency surgery. So here I go, headed off to the Heart and Vascular Institute here in Houston. And I had open heart surgery where they replaced the valve and they replaced a good section of my ascending aorta artery. And I thought that was it. I had never heard of mended heart, didn't know what was going on. Everything happened so fast. I didn't have anybody to talk to. I didn't even know what was going on. So they let me go home in about 2 weeks from that surgery. And guess what? The worst thing that can happen when you have a heart valve, a biologic heart valve, I had a big valve put in, is get an infection. I got an infection. Got an infection in that prosthetic knee from the surgery that I'd had a couple of years ago. That traveled to my heart, totally destroyed the valve they just put in. I had to have a knee surgery 2 months after my open heart. They waited 2 more months. And then by that point, the valve was completely destroyed. And I literally thought I was dying. And I was. They put me in, the hospital said, we're going to do a TAVR. And Edwards was very kind. And they said, this is what we're going to put in your heart. If any of you have ever seen one of these, this is what a TAVR aortic valve looks like. And he said, but I don't know if I'm going to be able to make it or not. So I'm going to have the surgeon sitting there. And if that fails, then we'll have to go ahead and do open heart. They put the TAVR in. He said it was extraordinarily difficult, but he got it done. Now I'm thinking, now maybe I'm done. Problem is, they put this smaller valve inside the valve that was already there, which replaced the valve that was there. And now this valve is not big enough. It's not big enough to provide the blood flow. So now I'm going through all the tests to have an open heart surgery yet again. So within the span of a year, I will have had 3 heart surgeries, 2 of them open heart, and 1 knee surgery just thrown in for good measure. Now, I tell you all that to let you know that this disease, this heart disease, doesn't always give you warning signs. Sometimes it just creeps up on you. I never had any heart problems. I never had a heart attack. I felt short of breath, but like a lot of you probably thought that was, I just figured it was because I was getting a little overweight and I was getting older. But no, it was my body trying to tell me something and I just ignored it. But I'm telling you, I don't ignore it anymore. And I think what I'd like to spend the rest of our time together is talking about some of the things I've learned from all of this. So if any of you have any questions or want to know anything more, make sure you type them in there and we can get all of this out. But, you know, it changes your life. When you go through this hard event, like we all have been through, or our loved ones have been through, you can't be the same. You know, it's funny. Every morning I wake up now, very different than I used to wake up a year ago. A year ago, I'd wake up and I'd just think of all the things that I had to get done that day. I felt in a hurry. I felt in a rush. I felt overwhelmed. I wanted to get on and get on with my life and get moving. Now I wake up and I lay there. And the very first thing I think when I get waken up is, oh, I am so grateful to be here. I am so glad to be alive. I look over at my wife and I'm just so thrilled that I get one more day with her. We've been married almost 35 years. And it changes you. It changes you sometimes for the good. And sometimes that journey to where you can really understand it is a process, not an event. I went through all kinds of emotions, and I'm sure many of you have gone through, and we're going to talk about some of those. But it does change you. It changes your lifestyle. It changes a lot of things about you. And you know what? There's an interesting saying that I keep saying to myself every day. You know, I can't control the uncontrollable, but I can control what I can control. So I can't control what my heart's going to do. I can't control what happens to me on the surgery table. I can't control getting an infection, what it's going to do. But what I have 100% control over is my attitude and how I feel about what happened and how I choose to react to the experience that I've got. So let's get in and let's start talking about how this thing can affect you. And I hope I can do this right. Yeah, okay, actually figured it out. First thing is a fear about what is about to happen or has happened. You know, when I first got done with my first cardiac event, I was asked to go to cardiac rehab. I didn't want to go. My doctor told me it was really important, you needed to go. I said, I don't want to go. They've got me on all this medicine to keep my heart rate down. And they wanted me to go to cardiac rehab, and I was paranoid. Went to cardiac rehab. Now, listen, if your doctor has told you to go to cardiac rehab, go to cardiac rehab. It ended up being one of the best things that I ever did, but I was scared to death about going. I remember going in and talking to the nurses there, and they talked to me about it, and I left. I wasn't going to do it. Then I got to thinking about it. I said, no, you're being a big chicken. So I went back. They sat there. They were so kind. They talked me through the process, told me they wouldn't let anything happen to me while they're in there. And over time, I got more and more comfortable. But it was that fear about what could have happened was something else. You know, when sometimes you just get a little twitch or you get a little feeling. And I talked to a lot of the folks that were in there, which it was sort of like a cardiac rehab / group therapy, right? And the funny thing is we'd all sit in there and talk about it. And I said, do you guys ever feel like if you get a little twinge, it says, oh man, I think that's it. I'm going back again. If my heart rate goes up a little bit high, they think I'm having AFib. And it really is amazing how something like that can just cause you to have a fear of doing anything. Anxiety about how your recovery is going. Anxiety about the procedure. Now, I will tell you, the first open heart surgery I had no idea what was coming. So I didn't have a whole lot of anxiety. Plus, they moved it so fast. I was in the process so quickly. I didn't have a chance to get too terribly worked up about it. However, this one, I know every single thing that's going to happen. And if you don't think that even I fight anxiety about what's coming or the procedure or what's going to happen, I just don't want to go through it again. But you know what? I can't control that, but I can control my attitude and my own emotions as I get ready for this procedure. Anxiety about the future. You know, I have grandchildren. and my children. And I want to see my grandchildren grow up. I want to see them get married. I want to be a great grandpa one of these days. And it's that anxiety about the future. Will it happen again? Am I going to live? Am I going to see my 70th birthday? Is always present. It's always present with us because we just don't know, especially when you didn't know it was going to happen in the first place. And then you get angry. You get angry about it. I mean, I could go through all the stages of grief that any good, trained person in psychology could go through. But boy, you just get mad. Why you're laying there? Why did this have to happen to me? Why is this happening? And so you don't be surprised if you begin to experience, or if you haven't, or if you're still in that. Let me tell you, this is not abnormal. You're not abnormal to be experiencing these things. Depression. You know that you are at a 3 times higher risk for being depressed after a major heart event than the regular population. 3 times. And it doesn't seem so bad when we think about a physical illness that we have, but to admit or to feel like we're depressed is just something that we just don't want to talk about. We don't want to think, we don't want to feel. But I'm guaranteeing you, do you think that I've been through depression with this? Oh, you bet I do, right? I mean, I went through this it was terrible what I went through with the depression. And you have to be careful with that. We'll talk about why you have to be careful with what you do about the depression. But just don't be surprised if you just want to go sit in a dark room and watch TV and not move. It just happens. Loneliness. I don't think there's a time that you could be lonelier than you're sitting in your hospital room by yourself, thinking about what's going to happen, thinking about how you're going to do, worrying about how it is. Nobody's there to see you yet. The nurses are all business. They aren't really ones that have anything to do. And, thank goodness for Mended Hearts. I wish I'd have known about them when I was in there, but I didn't. And that's why I've told Andrea and the folks down here in the Mended Hearts chapter that I'm in, I don't want that to happen to anybody else. I don't want anybody else to feel like they have to go through this alone. So as many people as I can talk to, as many people as I can go visit, that's what I want to do. Because it's in those periods of loneliness where you begin to what we call ruminate. And you just start thinking and thinking and thinking, and it just becomes paralyzing if you're not careful. But just understand it's normal. It doesn't make you a bad person. It means you're going through a very traumatic event to your body and to your emotions. You know what else is interesting? PTSD is not uncommon. About 1 in 8 people will experience this. So I say all of these things just so that you'll be able to see them and say, oh, that happened to me, or that's happening to somebody that I know, or I'm going in for my first procedure. And it's better to be forewarned than to discover it at the back end and think you're the only person that is. Let me tell you, you're not. You're not alone in this. And there's a light at the end of the tunnel. I'm just a few steps ahead of a lot of you, I think, in where I am in this journey. So let's talk about what can you do. And I think this is really important for us to kind of talk about. First of all, it's common. Recognize it and don't feel like there's something wrong with you. We tend to want to talk about it among ourselves. When you meet another heart patient, I've learned we ended up telling each other our stories. And it's that checking in every day as to how you're feeling and how you feel is so important, rather than to just ignore that. It's common. Recognize it. Don't feel you're a failure. Check in, see how you're feeling, be honest with you. I'm blessed. I have a marvelous healthcare team. I have a wonderful group of doctors and surgeons, and we work together. That's a problem of having a PhD in psychology. You overthink everything, research everything. So they know when I go in there, I have Googled the hell out of it. In fact, not only have I Googled it, but I don't understand half of the terms that are in there. So I got Wikipedia sitting over here and I'm reading the terms that they're there trying to make sense and understand, because I want to know what's going on. I just want to be a participant with this. So talk to your healthcare team. Tell them how you're feeling. I go in and see them every quarter, and now I'm seeing them like, it seems like every other week as we're getting ready to this. Tell them how you're feeling. Tell them how you're doing. This is not the time to just sit back and be stoic and act like there's nothing going on, because if there is something going on, they need to know about it. And you know what? If it isn't, it's something that you're just feeling. It's an anxiety that mimics how you might be thinking you're having a heart problem. If that's what it is, don't feel embarrassed or feel ashamed. Go talk to them. Find a good health psychologist. Now, there's all kinds of psychologists, just like there's all kinds of doctors. And so I would recommend, if you're feeling like you need to talk with somebody, if you're going through depression, find a good health psychologist, somebody who understands the impact that health issues can have on your emotional well-being. They will understand also the fact that there are antidepressants, we call them psychotropes, but there are drugs that you can take that will help with the depression, but you have to be very careful when you take these, because some of these anti-anxiety and antidepressant medicines have major interactions with some of the medicines that we may or may not be on. I know that some of them interact very majorly with one of the drugs called Plavix, which is clopidogrel. And so if you're taking clopidogrel, it's going to be hard for you to take one of these anti-anxiety medicines. So make sure that when you're talking to them, that they know all the medicine that you're working at. Make sure that your healthcare team knows what you're doing, and just be open to talking to those. Build a support system. Man, I can't emphasize that enough. A support team of friends, family, your church, Mended Hearts, the American Heart Association, whatever you feel like is going to be there to help. But it's not just finding them, it's being open to talking to somebody, feeling vulnerable, allowing people to help you, and not being afraid to share. Because when you do keep it inside, that's when you begin to pack it away and you open a door and you put up on the door, this is my fears of my heart. This is my heart surgery. And you start throwing all these things inside of that door, and then you close the door, and then you're not going to talk about it, and you're going to keep it all inside. Well, that's probably the worst thing that you could do. It's better to be able to get that out, to talk about it. Now, you will find that your spouse maybe doesn't want to hear it all the time, right? Gee, do we have to talk about what's going on with you every single day? Well, I understand she doesn't want to hear that, but I need to talk about it, right? I need to be able to tell somebody what's going on. That's why a group like Mended Hearts has been so great. You know, I've started doing hospital visits now, where I'm going and visiting with other patients that are in the hospital. And I'm not so sure who gets more benefit out of that, them or me. But we go in, and the very first thing they want to do is they're just so excited to have somebody to talk to. They're so excited to have somebody that just wants to sit there and listen to them. And they want to share what's going on, and they want to talk about what's going on. You go to the next room, and it's again, and you go to the next room, and it's the same thing. People just need to be able to vocalize what's going on inside of their life, because it's very, very scary. I'm going to talk about cardiac rehab again. Cardiac rehab probably did more for my recovery than just about anything. I went through the cardiac rehab with Memorial Hermann Hospital Group here in Houston, and they have them all over the place. There are nurses that are in there. There's exercise physiologists. They hook you up to all these monitors. There's somebody staring at those monitors the entire time you're there. They're in communication with your doctor. But more importantly, they have helped me get past some of the fears that I had because of the fact that they just cared. They were very understanding. They have been through this before. They've worked it. And we even had a little graduation ceremony. And there were 4 of us guys. They call us the white-haired gang. And there were 4 of us guys that were in that cardiac rehab together because you go at the same times every time. And even we created our own little support group within the cardiac rehab support group. So it was very effective for that. Taking antidepressants and anti-anxiety medication is not an indication that you are a failure. You just may need some help, right? It's kind of hard to build on top of when you're in the bottom of a hole. And sometimes these medicines can be very helpful, but don't self-medicate. Please just don't go reach in the closet, find something that was in there and just say, I'm going to take this. Even things such as like the fashionable things like CBDs and all of that other stuff, it can have a potential interaction. You must talk to your healthcare team, make sure that they know what you're wanting to do and what you're wanting to take before you do some of these things. So I hope some of that is kind of helpful about what you can do in terms of how this all plays out for you in your life. Let's go to the next thing. Well, I guess kind of being in summary is you might not be in control of what is happening to you, but you literally have 100% control over how you respond to these events. Be aware of when you begin to clam up and withdraw from events and other people. You know, I have this room in my house. It's my media room, and my wife calls it now my man cave. And during the day, sometimes I'll go in there and just sit quiet. I'll sit in there and either watch TV or listen. But boy, I'll tell you, it can be very, very easy to just stay in there, to withdraw from being around other people, to withdraw from the family, not wanting to go out and be with your family. Be very, very careful of just pulling away and isolating yourself. Let other people help you. Reach out to other people. And if you don't have anybody at home that you can reach out to family members, find some friends, talk to a healthcare provider. Maybe they've got some events that you could go to. Maybe there's different support groups that are out there. I'm still learning what all this stuff is because remember, a year ago, I thought I was perfectly fine. Just be careful of living with the fear of future events. I mean, I didn't expect to go through all that I've been through in this last year. I'm sure there's other things that could have happened. I could have had heart failure that I live with, and my heart just goes out to the folks that are living with this without an answer on what you can do with it. But I've been very close to it now, of that becoming a result of something that I have. Bottom line, this thing changes your life. And you can either get angry or you can realize that actually you have been given a gift of life. When you make it through this, you've been given a gift of life. And every day, it's wonderful. I remember when my mom was in her late 80s, and she wasn't doing very well, and I'd come and pick her up because I couldn't take care of her physically anymore. She was just required too much physical attention, but I went and picked her up, took her to lunch. Well, we go to lunch and I'd be all nervous about mom. We got to get there. We got to get there on time. I got to make sure I have towels there in case she has an accident in the car. I got to figure out where we're going to sit when we get in there. We got to hurry in before it gets crowded, get her back and get her in because I have a window here of what I can do with my mom. Well, this is what my mom wanted to do. She just wanted to be with me. She just wanted to hang out with her son. We'd go to the restaurant and she'd want to go look at all the flowers. She wanted to talk about the flowers and look at how they did it, the decorations outside. We went inside and she just wanted to make that lunch last as long as she could. And I used to think that was just, come on, mom, we've got to go. We've got things to do. We've got events that we have to handle. But my mom taught me a lesson about that. It's called being present, being in the moment. And I got to thinking, why is she doing that? And my mom was doing that because she was drinking in every moment that she could see. She was looking at the sun because she didn't know when she was going to see the sun again. She was looking at the flowers so that she could remember the smells and how beautiful they were. And you know what? When she told me those things, it clicked in me what I needed to do. So the next time I took her to lunch, guess what we did? We took forever to get inside the door. We looked at everything. We talked about everything. We shared things. And she said it was the best lunch she'd ever had. You know what? It was the best lunch I've ever had with her. Well, now fast forward. And guess who's wanting to do the same things? You walk outside, you see the stars, you see the sun, you see the warmth of it, you see the beauty that is around us that we have to be able to see every day. Take advantage of that. Take advantage of the change that happened in your life because you can be very grateful knowing that you almost had your last day, but you didn't. And that's a wonderful, wonderful, wonderful feeling to have. Now, I know I could probably rattle on, but I wanted to make sure there was some time for questions. So Andrea, I don't know what to do at this point, how to do all of that, but I'm more than happy to talk with you guys and spend what time we have left kind of going through this.
Well, thank you so very much. What a fabulous discussion, fabulous experience. Thank you for sharing it. I feel very grateful for us hurting. We have lots of questions and
good.
Tons of comments in the chat that we may be able to, if you have time afterwards, you can scroll through. Everybody's very appreciative. So the first question is, has anyone else, and I guess maybe people can interact in the chat or you, Dr. Rollwitz, can answer, find that anger interferes with motivation to eat right?
Anger is an extraordinarily negative emotion. Anger tends to hurt the person who's angry more than what you're angry at, right? And it's one of those things that you feel like it feels good to be angry, right? You want to scream and you want to holler, and okay, go ahead, do that, right? But give yourself, bind it with some time. Right? Say, I'm going to be mad for 2 more days, and then that's it. I'm going to be mad for another hour, and then I've got to move on, right? It's counterproductive. It doesn't help. It actually is more toxic than not. Anger releases battery acid in your brain called cortisol. Anger increases stress levels. And the last thing you need is a heart patient that's more stressed, right? So it's one of those things that it's deceptive in what we want to use it for, but it's not productive. I would replace being grateful, being thankful with the anger. But that's a process. You'll have to work your way through that. But my advice would just be put a bind on it.
Thank you. Somebody is asking, they had a heart attack and a quadruple bypass, but they feel like it's no big deal. And they want to know, is that normal?
Yeah, that's called denial. Yeah, look, when you realize what they do, the incredible science behind an open heart surgery, it's amazing. I mean, but the stress that puts on your body. I mean, I didn't know what was happening, right? They just said, we're going to go in and change your valve. I didn't know they were going to stop my heart. I didn't know they were going to run my blood through another machine. I didn't know they were going to breathing for me, right? And that is an extraordinarily traumatic thing. Sometimes denying that and saying, well, it's just not that big of a deal is self-protection. It's protecting myself from being afraid. Well, if I don't think it was a big deal, then it wasn't a big deal. But in reality, what you're really doing is opening that door, throwing it in, closing the door, and just playing like it wasn't in there. And that's called compartmentalization, right? The problem with that is it doesn't stay in that room. And it finds a way to vent itself out in ways that you're not aware of. It vents itself out through maybe your own thoughts and your own actions. Maybe it vents itself out through anxiety or stress. Stress is horrible for heart patients because it releases this incredible thing called cortisol. And cortisol is like battery acid, and it just does terrible things to you. And so the last thing you want to do is just deny anything happened. It's better to face it and then turn that around and be grateful. Grateful that you're through it. Grateful that you've lived through this. You know, I think that's a much better approach, but it's a tough journey. I'm never going to fault somebody for going there because guess what? I went there too, right? But don't stay there very long.
Yeah. So coming from a mom of a child who had open heart surgery, what would your piece of advice be to parents whose children are on this journey, because it's a different journey?
Oh, yeah.
To deal with the anger and the fear. I resonated when you said the fear of what's to come, because he'll need another open heart surgery and that fear is there constantly. How would you suggest that parents deal with that?
You know, let's expand that to one other thing too. But parents are the bystanders in all this, right? They're the caregivers. And so was my wife, a caregiver. And I can't think of anything harder than watching a loved one that you love suffer, or fear of losing them, or fear that there's something you could have done more to seen it or stopped it or interfered with it. The caregivers have their own journey. And sometimes we forget, because they're not laying in the hospital bed, that it's not the same. It's different, but it's just as hard, if not harder, right? So, you know, I think the fact that they need a support group too, they need to be able to reach out. Mended Heart's wonderful in the fact that they acknowledge the caregivers and they talk to them and they provide resources for them. Just don't feel like you failed your loved one because they're sick. They're sick because they got sick. Nothing my wife did gave me my heart problems, right? I could not have made it through a lot of this without her. And the children certainly couldn't without mom and dad, right? So, you know, I don't know if I answered the question. I get a little emotional about that because often they're so forgotten.
Well, we appreciate that. And emotion is perfectly acceptable in our world. And that actually leads into the next question from somebody who definitely says he feels grateful every day but he's also very emotional and cries easily and wonders if this is typical.
Well, you're talking to a guy that just cried. talking about this. You know, this is I think I probably could have understood it as a trained psychologist who had a PhD in psychology intellectually. But you know, when you go through it, it's different. It moves from here to here, right? It's no longer an academic exercise, it's something that you feel. And because it's such a profound event, I mean, we all know we're going to die. I just knew it was going to happen. It wasn't a theoretical thing that was out there. It was something that was right here in front of me. And so that tends to make you emotional, right? Now, crying and being tearful when you talk about it is different than being crying and tearful all day long, every day, right? So let's differentiate between the two. You know, I think it's perfectly fine to be emotional about what's happened to you. If you cry constantly for no reasons whatsoever, that tends to show more of me that you need to be talking to somebody to kind of help you process this stuff and kind of help you get your hands around it, right? Because it's just overwhelming. And so while tears are okay, it's that balance between them that you have to kind of, I think, be careful for. But I hope that answered that one.
Yeah. So there's a question here. How can we find a good health therapist in our own areas? I have not been successful in finding someone that would specialize in this. And I didn't realize there was a difference. So,
you know, there are psychologists, and let me explain. There's a difference. To call yourself a clinical psychologist, you have to be a licensed PhD, right? You can be so when I refer to the term looking for a psychologist, that's what I'm referring to, right? I'm not denigrating anybody who's got a master's degree, but I just use the term that way because, you know, I wanted to make sure you understood that. I think the most important thing is finding a therapist, one, that you can talk to, two, that you have a connection with, and three, understands what you're going through is not just because of some life event, you almost died, right? Or you've had this horrific experience through and how that can change you or impact you. They can help you without actually having had to go through it, right? So if I was going to say, would it be hitting all the boxes if you could find somebody that did all that? Yes. If you can guide all the boxes except that last one, and you could still go talk to that person, right? Because they don't have to. If they've got empathy, if they're a very good either psychologist or a therapist or whoever is there, if you can relate to them, that's half the battle, right? And finding them. Oh my God, it's so difficult. Sometimes it's maybe talk to your cardiologist. Maybe they know, right? Maybe some of the nurses know. Maybe somebody in Mended Hearts in the chapter that you're with or around you that says, hey, I've talked to somebody, I've worked with somebody. There's thousands of wonderful, caring psychologists out there. You just got to find one that fits for you.
Great, good advice. So there's one question here that's probably better for me to answer, but it says, I felt so alone. This series and your sharing, Dr. Bill, is so helpful. Mended Hearts is so essential to recovery. Is there a way to connect with others from the beginning? That's the $1 million question, and one that we're really working hard at here at Mended Hearts to get people involved earlier so that they are not going through the crisis stage alone. So we are working on a new marketing campaign to hospitals and cardiologist offices in hopes that people will get our information earlier And so when they do get diagnosed, they have that support from the very beginning because it's critical from the beginning. But so talking about relying on other people, because you probably were independent and did everything for yourself and probably even helped your wife and kids. How do people process now having to rely on somebody else for their care and their help, and what type of suggestions do you have for that?
Yeah, as we get older, there's a few things that we feel like we lose control over, and there's some things that we just fight to keep control over. And one of that is independence. One of that is I can do this myself, right? Men have this thing about being men, right? And we have to be independent. We have to be self-sufficient. Women are the same way. We've got to be strong. We've got to be this. We've got to be that, right? And so it's very difficult to ask for help. But you know what? That's what you need to do. And it's okay, right? Let me tell you this one story. One of my grandchildren is a boy. His name is Colton, and he's wonderful. He's 16 years old. It's a 16-year-old boy who's on the football team and the wrestling team. He's about as macho male. Every time I hug him, he flexes, so I'll feel his muscles even more. But when he found out I was going through the hospitals again and going to have another heart surgery, he calls me up and he calls me Pop Pop. And he said, Pop Pop. I said, what? He says, I'm going to call you every day. And I'm going to call you every day and I'm going to just talk to you and I'm going to tell you a joke and I'm just going to call you every single day. And I thought, well, that's wonderful. Thank you. And I didn't think he'd do it. He's called me every day for the last 6 weeks. He comes over and he says, what can I do to help you? What can I do? I said, well, how about this? And I said, well, here, let me help you. And he said, you let me do this for you. It's a 16-year-old boy. He calls me every day. He helps me when I get to stand up because it's a little bit difficult. Sometimes I wobble a little more than I want to just because you kind of feel a little bit disoriented sometimes, especially when you stand up and you're taking a whole bunch of medicine. You have to be very careful not rising too quickly. But there's nothing wrong with letting people minister you. There's nothing wrong with letting somebody love you and show that love through helping you and doing things for you. So you know what? If somebody wants to help you, boy, let them. Let them. I've learned that lesson.
It might actually be good and therapeutic for them as well to be
a
helper. Yeah.
It is. You know what? I get more from my work with Mended Heart helping the other patients that are going through this probably than maybe they do. Right? And I hope they get from it. And, back to your other question, how can we do it at the front end? Well, one of the ways we can do it at the front is we can get more people visiting people in hospitals. One of the things that we can do is get more people involved and feeling part of this group organization. If you've been through it and you found out about it afterwards, that's what I decided. I said, look, I've got the back half of my life. I don't know how long I'm going to live, but I'm dedicating myself and have dedicated myself to helping people on this journey. And I don't have to. I can be selfish and just hold it inside. But you know what? That doesn't help them and it doesn't help me. And I don't want anybody else to feel so alone through this, right? So if part of the way to do it is just to get active, to get involved, to be a part of the solutions, not just sitting back, right? So I had to throw my 2 cents into that one too.
Love that. So the next question is, being that this lady has not had her open heart surgery yet, and she's wondering about visitors at the hospital when she has open heart surgery, or people from Mended Hearts, which we could connect you, Shannon, locally with Mended Heart visitors. But she has her husband and her daughter. So she's wondering what types of supports and she should be looking for and how to optimize that while she's in the hospital.
Yeah, the open heart's not we're going to operate on you on Sunday and you're going home on Monday, right? So you're going to be there a while. At least I was, right? So I can tell you from my perspective how it was. It's much better now than it was in the middle of COVID. I went through my open heart in the middle of COVID, which was horrible, right? Because then there were no visitors. The hospital was locked down, right? I mean, literally, if I'd have gotten that virus when I was in that hospital, it would have killed me. So now, in my case, this is how my process went, right? You go into the hospital, they do the open heart, they put you in cardiac intensive care. You'll stay in cardiac intensive care for a period of time. I stayed there about 6 days, almost 7 days. From there, you go to your room. In cardiac rehab, you may be in there with heart transplant patients. You're in there, people with bypass, whoever's had that kind of stuff. You're in cardiac intensive care because you've had a pretty significant surgery, right? There is somebody sitting at the foot of your bed 24/7. You are being watched like a hawk. They are all over you 24/7, watching you. And the good news is you're not really aware that much of what's going on. My wife and my friends tell me I kept calling them while I was in ICU, and I don't remember doing that. They remember, but I swear they're all just fooling with me. But when you get back to your room, you should be able to then start having visitors. And each hospital has, how many visitors you can have, whether they're family or not. I told my wife I didn't want her living up there all day and all night. I told her, go home, go home, go with your girlfriend, go out to dinner, have a normal life. Trust me, I'm in great hands here. I'm surrounded by people doing things to me that I never wanted done at 3:30 in the morning, right? Was when they always chose to come in and weigh me, which I never understood why I was being weighed at 3 in the morning, but they did. So just check with the hospital on their visitor policy and then they'll be able to tell you, but it's much better now, at least it is here in Houston, than it was.
Yeah, and I think what you said about making sure that the people that are your caregivers, your husband, your parent, your spouse, whoever, needs to make sure they're also taking care of themselves, because you don't have to have them there 24 hours a day. They need to take care of themselves and make sure they're giving themselves an emotional and mental break from the hospital as well.
Yeah, one thing I realized too is their job really starts when you come home, because the recovery is lengthy once you get home from an open heart surgery. And so I didn't want her living at the hospital. I had nurses. There's not much she could have done there anyway. And so she came up and saw me every day, but she stayed for a while. And so that was good. But boy, when she came home and she had to learn to get help and let other people help her and help people minister to her as well, right? So everybody needs everybody. It takes a village to get through this stuff, right? And so the more you can do, the better it is. And then having visitors see you in the hospital makes it not seem so lonely.
Yeah. Well, I think that we have come to an end of all of our questions. Before we leave, I'll just send out one more request. If you have a quick question, you want to put it in the Q&A box, I will put it out there. Our next and last webinar on our mental health educational series will be next Tuesday, May 24th from 3 to 4 o'clock Eastern time. And this one is mood disorders associated with heart events. So not just your regular cardiac blues, we're talking about actual mood disorders that may need some type of interventions. Mm-hmm. My cat is joining me, sorry. And the presentation will be available probably tomorrow afternoon. It will be sent out to everybody who is registered for the event. So everybody will have a copy of it, and then it will also be posted on our website as well. Please feel free to share. And Dr. Rollwitz, thank you so very much. We really appreciate you being here and sharing about this topic, because we thank you from a patient perspective, and we as a professional, thank you very much.
Thank you, guys. Thank you. I hope this helped somebody.
Thank you.
It did me.
Well, it helped us. Thank you. Have a great day.
Bye-bye.